If you're in search of a dental implant solution for your missing or unhealthy teeth, it's important to know that not all options are created equal. Quality control, credentials, and predictability are really very important.
Dr. Richard Aguila of Jacksonville Dental Specialists is here today to talk about Highbridge and becoming an informed consumer when evaluating your options. Welcome back.
Thanks for having me.
So let's what should people out there be thinking about when they're going to make a big decision like this?
Yeah, she kind of said the three main topics that you should look at. One is the credentials of your providers. You should know the level of training of your dentists or your surgeons that are providing you the treatment. At our office, we have two specialists. I'm a periodontist. My specialty is on the surgical side. So it's a surgical residency 3 years beyond dental school. And my partner, Dr. Naraki, is a prosthodontist, so his expertise is on the restorative side. So we combine our training experience and treating the most complex cases for patients. The second thing that you mentioned was predictability. You should be ensured that your providers are using treatment modalities that have been researched, that are up to date and give predictable outcomes. At Highbridge, we use a treatment modality that's been around and perfected for the past 20 years. So it's something that's helped thousands of patients. And it's allowed us to be one of the biggest full arch implant providers in the Southeast. And the third thing would be the quality assurance of the product. So we want to ensure that you're getting a good product both on the restorative side using labs of the highest quality and also on the implant side, using implants that are of the highest quality as well. So at Highbridge, our Highbridge process, we use labs that are here in the United States and the implants that are actually made and manufactured here in the United States as well.
Talk to us a little bit about the technology that you have at your office for the Highbridge dental implant patients.
Yes, it's just a great time for both doctors and patients because the technology is just incredible. The technology allows us to provide our treatment in a simple, predictable, and safe manner. One of the things that we have is its cone beam CT scan. It allows us to look at the bone in 3 dimensions, allows us to basically do virtual surgery before we actually see the patient. We also do digital impressions as well. You don't have to have the gooey material in your mouth to have impressions made, and it makes the fit of the final prosthesis very accurate. We also do a lot of sedation with patients. So our patients typically come to us with complex problems. So we try to make it a very pleasant experience for them. So we sedate them. They pretty much sleep throughout the procedure and don't remember anything. It makes it more comfortable for them.
When people ask me questions, they talk about, with this Highbridge, you're going to get a full mouth. You would think you're going to be without teeth for a little bit, but nobody wants to be without teeth. So how do you answer that when somebody comes with? Is there going to be a process during the weeks it takes where you don't have teeth?
That's a great question, and it's a big concern for our patients. In no time will you be without teeth. We make the call if it's a removable temporary versus a fixed temporary. For patients that really need a fixed temporary, we do everything we can to ensure we can provide them with a fixed temporary, assuming we do our treatment in a predictable manner. So in no time will you be without teeth. You'll always have teeth. What we don't believe in is going to the final prosthetic the day of surgery. There's just so much healing that occurs, so much changes that occurs. You can't change biology, you can't change wound healing. So if you go to final prosthetics, we feel that's not a good idea for our patients.
When you're talking about going to a dentist or doing any work in your mouth, it's very emotional because people are scared. I mean, you talked about the sedation a little bit, but is completing the treatment painful at all?
That's a great question. And I'm not going to sugarcoat it and say it's completely painless, but patients actually do very, very well. During the procedure, as we talked about, you're sedated. After the procedure, you're given medications that are more than enough to take care of the moderate discomfort that you have. Oftentimes, patients that see us for this problem, they're already in pain. They've got abscesses, they've got infections. So just by going
addition
through
by subtraction almost.
Going through the removal you get them out of pain. So the pain, if there is any, it's only for a few days, and then recovery happens, and then by the time you know it, healing occurs, and you're moving on to your final prosthesis.
Well, good stuff. We're out of time here, but one of the best ways, if you can't get all your questions answered here, is to check out the seminar. And you got another one coming up right there. It's on your screen, September 19th, 6:30. And Doc, that's really the best place to get all your questions answered, right?
It is, yes. You learn about all your implant options. You get to meet the staff. You meet the doctors. From there, you get a complimentary consultation.
Very good. Appreciate your time again.
Thanks for having me.
And we want to thank Jacksonville Dental Specialists for being here and sharing this information and their services. And you can visit jacksonvillehighbridge.com. You can also call 904-584-3867.